I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambekar, and today let's talk about why CT scans are not as good as mammograms when looking for breast cancer. This image is of a CT scan compared to an MRI. This patient does have fairly dense breast tissue, which is why it's very subtle on the CT scan, but on the MRI, there's a lot of what we call non-mass enhancement. So this is definitely a breast cancer. This is another image of a patient who had a CT scan and had a lot of dense breast tissue, and the CT scan didn't show the cancer, but when they had a PET scan, it did. This is another image demonstrating the same thing, a cancer that would have been missed on a regular CT scan, but was picked up by a PET scan. This is an example of a breast cancer which was fairly easy to spot on a CT scan a patient had for another reason. You'll notice it's because this patient does not have a lot of dense breast tissue. They don't have anything for this cancer to hide in. And this is a category A or fatty replaced breast, which only 10% of the population with breasts has. All of the masses that I showed you before were at least 2 centimeters, meaning they were about an inch in size. All of those were invasive ductal cancers, and they were all at least about an inch in size. Compare that to this mammogram, which is showing us pre-invasive cancer or stage 0 ductal carcinoma in situ. And that's what these calcifications or little white dots are showing us. Here's another view of them. A CT scan can only pick up cancers if they're not hiding in dense breast tissue and if they are a little bit larger. Whereas a mammogram can see calcifications and cancers even when they're hiding in dense breast tissue, just like this mammogram right here, and can pick up calcifications or cancers at a much earlier stage, which is why they're still the gold standard for breast imaging, as uncomfortable, painful, and sometimes even traumatic as they are.